Welcome to Plugged In Chatham-Kent. I'm Andrew, I work in economic development, and I'm here with, the podcast, episode number 28. Again, talking is hard for some reason. I have a very special guest. Normally I would pass it over, but today I'm not going to do that because this is very exciting for me to talk to Lori Marshall, who is the president and CEO of the Chatham-Kent Health Alliance. And so thank you, Lori, for being here.
Oh, it's my pleasure, Andrew.
It's really appreciate it.
Yeah, great.
Healthcare is a huge topic in general, and it's almost as though people in Canada are very proud to celebrate it. I don't know what that's about, but I'm just saying that our healthcare is better than the States. I said that on a podcast. I think what people don't always connect is that healthcare and business sort of go hand in hand. And I was telling you a bit about before we started that we have businesses who are always curious and interested to know how things are going locally, because they want to make sure that their people are they're not just employees, they're people, and they recognize that, and they want to make sure that they're healthy and looked after. Mm-hmm. And I thought, well, what better opportunity than to ask the CEO of a hospital to come on and sit down and chat. And so how are things going? You've brought a report.
Yeah.
What's going on with this?
Things are good. I would say we're into year 2 of our strategic plan. Mm-hmm. And that really is our commitment to how we're going to help our community together, working with everyone to become a healthier community. So fits perfectly in with, businesses wanting to move or come to Chatham-Kent. They want to come to a community where their staff are going to be well taken care of, where people and families can thrive. Absolutely. So it is about all of us being healthier. So we created a 3-year strategic plan to get us there. And what's really exciting is we've sort of now taken the look back about year 1. How did we do? And so 97.9, we don't want to say 98% of the goals and objectives that we set out for ourselves in that first year, we've been able to accomplish. And so that's terrific. And the areas that was in terms of the patient care side of things, one was about making sure that we provide comprehensive services to the community. So Chatham-Kent Health Alliance, 2 sites in Chatham and Wallaceburg, and we're a community hospital. So there are certain things we will never do. We won't be a transplant unit or burns or those very complex kinds of things where you need to go very specialized centers. And we also believe that the majority of services that people need to access should be available from our community hospital. And so we identified there's a couple of areas that we identified early on in our strategic plan that were gaps. Mm-hmm. And the first one is urology services. Okay. And so really delighted to say that we're on track to bring urology back to Chatham-Kent in the summer of 2020. So that involves almost everybody in the organization. It's everything from purchasing equipment to lead lining walls in the operating room, through to, changes have to happen in the lab. There are different lab tests that we need, all of these sorts of things. And so I would say under the leadership of Dr. Elizabeth Haddad, who's our chief of surgery, she's really spearheaded this project in our organization, working in collaboration and partnership with the urologists, the surgeons from Blue Water Health in Sarnia, who I would say have been our lifeline as a community. That's where people are accessing their services now. And what we're talking about in the future is really sort of a sub-regional program. There'll be an element of coverage between the 2 communities. And so, we think that's a partnership that's worthy of celebration and further investment and having those services locally. So that's, I'd say, one of our big wins in that particular area. The other thing that, I think is a gap, and not necessarily because it was a planned gap, it has to do more with what I think we're seeing across not only Chatham-Kent but across Canada, internationally, is concerns with respect to addictions and substance use. And so we realized that that's an area we need to do some more in. We're very pleased that this July we were able to open the rapid assessment to addictions medicine clinic. Very limited hours, but even so, they're already exceeding their initial sort of targets in terms of the number of patients that they would be able to see. So those are some of the, I'd say, wins in terms of what we said we wanted to do in closing some of the gaps in that comprehensive care. And then in terms of the other patient areas in that strat plan, one is around really involving patients and family members in how we design our care and what we do. So bringing people to the table. So we have, I would say, I think it's close to 24 patient advisors who are people who either themselves have experienced care at Chatham-Kent Health Alliance or a family member have been a caregiver. And they come in and they share their stories with us. And then they also give us advice on how we design things going forward. And sometimes it's a retired teacher who says, I'd love to correct your grammar on a piece of material that's going to go out to patients to make sure that it's readable from a patient perspective, right through to people who sit on and donate a lot of their time to sit on committees and councils and things to give us their advice at the table and sit on interview panels. So really we're trying to make sure that our organization is responsive in that respect. So that would be the other sort of another clinical area. And then the third is around thinking about that Chatham-Kent, when even though we have 2 sites in Chatham and Wallaceburg, only 40% of our population actually lives in the city of Chatham. The other 60% live in the rural areas. And so, you know, if you speak to someone from Ridgetown or Tilbury or Dresden, they would say, well, we don't have a hospital in our community. So what is it that Chatham-Kent Health Alliance could be doing differently with us? And, you know, I think that's where we started very much to think about different ways that we can help to serve the community that don't necessarily mean being in the hospital, working more with home and community care. How do we institute things like more technology in the home to do remote monitoring and those kinds of things? And it really opened the door then as well to start to talk about partnerships with other organizations. And I know you'll probably have questions later on about the Ontario Health Teams, but I think that this was a natural precursor for us to start thinking differently about how do we become, as Chatham-Kent Health Alliance, a partner of choice that other organizations want to work with, as opposed to being sort of the big hospital that's sitting there all on itself.
It's a pretty drastic change, and I don't think people realize that how much that sort of siloed environment was. It was hospitals do this, and this organization does this, and this organization does this, and that's it. Those are how things are structured. It sounds very much like you're changing that in huge ways to say, how do we work with, how do we partner, and that has to be successful in many ways. Yeah. So congratulations on that. That's great. That's really positive to hear. Because as you said, it used to be, well, Chatham Hospital. This is what you do.
That's right.
And it sounds like you're making huge strides on that. So,
yeah.
So okay. So on that, let's talk about the Ontario, the health team. Can you give me a bit of context into what that is?
For sure. So one of the things that people have probably heard me say before, if anyone's heard me speak, is that I believe the riskiest time for any patient is when they transition between different organizations. Yes, and so, you know, that relates from everything from we have different policies and procedures. Sometimes we use short forms and acronyms. The one that comes to mind that someone brought up the other day was if you say PA, some people think that means physician assistant. For other people, it means patient advisor. Two completely very different roles. And if you're in 2 different organizations and somebody uses those, you can be confused about what it is that they mean. We have different electronic health information systems or paper-based systems. So people will feel that they're telling their story over and over and over again and assume that we know that information from your doctor's office or from another provider that you've been to. The reality is that our systems actually don't speak to one another. So what the Ontario Health Team concept does is really allows for organizations that have functioned in more of that silo perspective in the past to now start to collaborate in a very different way, thinking about if we were going to start scratch, how would we design the system and what would we do differently? And so we don't have the benefit of starting from scratch, but what we do have now is really an invitation from government across this province to start to be designing and working on things a little bit differently. So we were, when the opportunity first came out in the spring, I would say one of the great things about Chatham-Kent is we are very relationship-based in this community between all of our organizations. People know one another. We can pick up the phone and speak with one another. And so it was easy to pull a group together to say, is this of interest to us? Do we want to go ahead and sort of design our own destiny versus waiting a couple of years and have someone tell us what to do? And so we submitted the self-assessment. Back then, we were one of over 150 who submitted that self-assessment. The ministry reviewed those, and they came back, and they invited 31 potential Ontario Health teams then to do a more deeper, in-depth proposal. So the self-assessment was more about, tell us how you've worked together in the past to give us the confidence that you could work together in the future. And then the proposal was a little bit more about, well, what might you do, particularly in the first year? If you came together and worked together, what could you do? So we were one of 31 that submitted, and we went through a site visit. The ministry sent some representatives out to meet with all of the proponents, and we're anxiously awaiting at this stage what might be the next steps.
That is really, that's 1 in 5 if my math works out right, of being selected. That's great. That's a huge step to know that there's been those proof that the partnerships are working. Like, it's not just saying, hey, partnerships are working. It's proof that they're working. I'm going to ask you the when question. When do you think you might hear back from the ministry? Although that is a really unfair question. I'm so sorry. But I'm going to ask you anyway.
well, we're certainly hopeful that we might hear in the near future that we would progress. And I would say regardless, what has come about from this collaboration, we have 15 signatory organizations that range from the family health teams, all 3 family health teams, the community health center, and I'm going to forget somebody if I try to name them all. I'm not going to put you... and everybody. But the really wonderful thing about coming together to work on this is, I speak about this being, it wasn't really a proposal. This was a process. And so regardless of the outcome, we will continue to work together towards the things that we identified that we believe that we can improve across the system. So, really, this was an opportunity for us to do some different thinking together, and the collaboration just got deeper.
Do you think this is going to help with that sort of, they call the warm handoff of patients? Is that what you're seeing already? Is the improving, rather than just saying here's a note and that's the end of it? Is it helping in that sort of capacity, or is that the plan to help in that capacity?
I'd say absolutely. And one of the things I'll mention is, in leading up to the proposal submission, we had a board meeting with all 15 boards in the room, which was a little bit daunting. And one of the things we did, though, with that group in the room was we had everybody sitting at their own tables, and then we said, imagine that you're a patient of your organization. You're getting great care from your organization, but something's changed. And we gave some little scenarios, things like you've been newly diagnosed with diabetes, or you have a family member who needs long-term care, or you're looking for just general health promotion information about how you can become healthier. Please go and find where you would get that service from. And, these were board members, in theory, well knowledgeable about the services that we provide in this community. And it was a great aha moment, because I would say most people sort of went, I'm not sure where I would go for that. And so that speaks to that concept of the warm handoff. And so it was a great kind of icebreaker, people walking around, talking to different tables, saying, well, do you give this? Do you offer this? And in fact, even just at that meeting that night, there were a few new connections that were made for different organizations. So I think that it is just going to get more and deeper with respect to our ability to do that warm handoff and to make sure that we connect people to the right kinds of service and care that they need.
That's really good. That's fantastic. I want to jump a little bit over to, you mentioned Wallaceburg site, and chat a little bit about them, because I see in the plan here, it's even mentioned, the power plant project is underway. It's moving forward. How's it moving forward? How's that?
Well, yes, and what you have in front of you is that it's at stage 3.2 of the ministry's 5-stage process, I believe.
The points, right?
Yes,
that's the important.
Yes. The points are important. So we continue to work with the ministry through all of this. And the other piece is that we've submitted the program master plan to the ministry for both sites for the for the really long-term future of both of our sites, because we believe they're both assets that need to be continued to be updated as we go forward. And then I would say the other piece is that those are larger projects. And then what we definitely also have been the recipient of over the years is some additional funding. One of the things I remember tweeting a picture about in Wallaceburg was the old wooden windows when they were removed and new windows going in. So, just some of those changes as well are significant in making sure that we identify how it is that we can move ahead.
I've been fortunate. Both of my kids had before they were born, we were in there with my wife and doing the scans and the ultrasounds and all those things. And I have to say, at both sites, but for the Wallaceburg one in particular, a little close to my heart on that one, because you get to see that first little picture of the person.
Yes,
and
for
sure. So in that sense, it was wonderful for that site. So I'm giving a shout out to Wallaceburg out there.
That's great.
And thank you.
Great.
And thank you for that, because that local service, as you talk about, it was so important. I'm so glad I didn't have to travel out to London or not to say that it's a far drive, but it was wonderful that in Chatham-Kent
the more care we can deliver close to home, the better.
And so I have 2 wonderful children because of that type of
That's
care.
terrific.
Jumping over to so physicians. Speaking of new things and all kinds of wonderful things, you don't have to get into all the names of everything, but I've heard there are some new physicians that have come to the area. So your recruitment efforts must be doing very well in that aspect. I think if people are really interested, follow Twitter would be the best way to sort of keep that in. Is that the best way to do it?
Probably, yeah.
Okay.
Yeah.
Okay. Let's think it's
At Facebook, we also
Facebook.
posted on Facebook too.
Okay.
And I think Instagram.
And
I just don't personally have Instagram, so I can't attest to that. But
I will get your communications person a little nudge and get her, Fanny, if you're listening, which I'm sure you all will be. Instagram. You heard it here. But she's gonna shoot me. So what else is happening in local healthcare? 2020, what's going forward? You said you were in part 2 of this plan.
Yeah.
So what's next?
When I first, I'll close the loop on the physician piece.
Sorry. I'm sorry.
It's important for us to acknowledge that we are a partner in all of this recruitment efforts, because it really is a whole community that needs the support. So the hospital focuses more on the specialists and things like our surgeons or emergency room or hospitalists, physicians, psychiatrists, you name it. We've been recruiting all of those different specialties, and the community tends to focus on the family practitioners. And where we come together is that there are family practitioners, family physicians who also work in the emergency department, also deliver babies, may want to work as a hospitalist, those sorts of things. And so what I would say is I think we've made some great strides as a community overall in recruiting specialists and family practitioners. And it's something that we continue to dedicate efforts and resources to. So you mentioned Fanny. One of the things we did for an 18-month period, and she's probably maybe 5 or 6 months into that 18 months. She was a former recruiter at the hospital, and we felt we needed a little bit extra effort in that particular area. So we did some other things with some of her other responsibilities. And so she's really seconded into helping to support physician recruitment for that 18-month period in order to help bring us up to a level where we feel comfortable with.
Well, that's perfect. That's great. And I know she does a great job. So now you don't have to shoot me quite as much, Fanny, for putting on the spot about the Instagram thing. Okay, so let's look at 2020. So where are we going with 2020? What's going to be?
Yeah. So
projecting.
Well, at the hospital, we're a little obsessed right now with the implementation of a new computer system. So that comes in June of 2020. And so we, along with 4 of the other hospitals in this region, so Windsor Regional and Hotel Dieu and Terry Shores and Leamington, are all implementing in 2020 a new Cerner information system. And the way that I can best describe this is I go back to my roots as a pharmacist. And when I graduated from pharmacy many years ago, it was essentially commonly accepted that you would have 1 error per patient per day. And that was just accepted from a patient safety perspective. And that, could be anything from, a 10-minute delay in you receiving something. It could be that somebody misinterpreted how the order was written by the physician in their transcribing. Everybody talks about physician's handwriting.
Yeah.
It is a challenge. It could be that somebody dispensed the wrong thing or the wrong dose or the wrong route. It could be that once it got up to the floor, the wrong thing got pulled or what have you. So you can imagine that there are lots of ways that a medication error can actually happen when you don't have a system that ties it all together. So let me describe for you the new system and how that is essentially almost eliminated. So picture now, instead of the physician writing an order on a piece of paper, they're entering the order directly into the computer system. Okay. So automatically it's going to correct the physician if they wrote 50 grams instead of 5, for example. It's going to set off all kinds of alarm bells. You didn't really mean to write this, right? Yeah. It would identify if there are interactions with something else that they've written. So it takes some of that guesswork out of it for the physician. That order then directly goes into the system to the pharmacy department. There's no need for somebody else to transcribe it and try to relate it to somebody else. The right drug is dispensed, put into a cabinet. When the nurse is ready to administer that drug, they will swipe their ID that will show this is this nurse. The right medication pops out. The nurse takes that to the patient's bedside. They will swipe the medication. They will swipe the patient's armband. And again, alarm bells will go off if that's not the right thing to be giving to this patient. Wrong thing. And then it's also going to document automatically that the nurse has administered that medication to the patient. So that's something they call now closed-looped medication administration. And for me, that's the best way to describe kind of old system and new system in terms of how the world has changed, I would say, in terms of electronic health information systems and their connections to all of the other things that we do with barcoding and all of those kinds of things. So that's what we're deep into right now. And I'm really looking forward to how this is going to really revolutionize, I would say, patient safety at Chatham-Kent Health Alliance and across our region. So that's I'd say the biggest thing that we're focused on in the near future. The other things that I think are important to note, particularly given some of Chatham-Kent Health Alliance's history, is we continue to we've had 3 years of balanced budget positions. So from a financial stability perspective, we're in good shape. And certainly planning to go forward into next year in that same position and still be able to introduce new services like urology. So that's within our planning and how we approach that. And then the other thing I would say is about our culture. And it's something that we want to make sure that Chatham-Kent Health Alliance is a place where people want to practice if they're a clinician or come to work, and that they're proud to say that they're part of that organization. And also that it's a safe place for them. And I think that's one of the changes when we looked at our values when the new board started in April of 2018. So brand new board, didn't have affiliations prior to that, and they came on, and we had two sets of values at that time. And they said, it seems odd that we would have one set for patients and one set for staff and physicians. Let's make sure we have one. And they looked at the commonalities, and when they did that, there was a glaring, I would say, omission, and that was around safety, both from a patient perspective as well as from a staff and physician and volunteer perspective. And so they very wisely, I would say, said, you know what, safety has to be one of our values as an organization. And I put that back in place. And we've had, certainly I described a patient safety example there with the closed loop medication. But on the staff safety side, it is a lot about physical safety. So things like workplace violence and making sure that it's a safe place for people to work from the physical side. It's also about psychological safety and making sure that the culture is such that, if you make an error, that you feel comfortable reporting that error, because chances are that wasn't you purposely trying to do something wrong.
Yes.
Right? Most errors actually are rooted in some kind of system or something that happened along the way that led to that. And if people are afraid to report when these things happen because they're afraid of the personal consequences of that, then we miss huge opportunities to change how we deliver care in the future and to correct those things and to make sure that we're putting those things in place. So I think that's another big piece for us, is about that whole safety culture, so that people do feel comfortable in identifying how it is we really need to improve. I think we're getting there. We're seeing some changes in our engagement scores, and we're not where we need to be yet, and we're making good progress.
The congratulations. Let me start off by saying congratulations, because that's we've talked to businesses about this, and being able to. My last chat with someone was saying, all of the things they've learned in their first year of business and the mistakes and recognizing those mistakes have meant they can improve. And had they ignored them, they would be in probably a far worse position than when they started, because you don't advance. You don't stay where you are when you make mistakes and ignore them. You slide backwards. And so congratulations, and having that open culture where you can say, okay, look, I've made a mistake. I didn't want to make the mistake. How do we fix this? And recognizing that. And yeah, you get some backlash from public or from others and around, but you fix that. You resolve it, and then it doesn't have to happen anymore. And so that is a huge culture shift. And so, as I say, congratulations on that. Well done. And it's very brave. Very brave to do that type of thing, because it's much easier in the short term to sweep it away and to ignore it. And hospitals or in business or in life. So well done. Yeah, good job. Anything else that you want to bring up before we've been chatting for like half an hour now? Hard to believe, isn't it? Amazing, eh?
I think what I would say is that I believe that we have restored community confidence in Chatham-Kent Health Alliance. I see that in our patient satisfaction scores. I see it in our staff engagement scores. We see it in the success of our foundation, who I think do a tremendous job because, like it or not, the government can't pay for everything. And so we need to do fundraising in order to make sure that we have state-of-the-art equipment. In my mind, a well-run hospital has got lots of great staff, physicians, and volunteers that do the work, and then they need the tools and the four walls around them that are up to speed with respect to giving them the opportunity to do their job well. And so really appreciate the foundation and what they bring to us. And so therefore, therefore, they can only be successful with a community that believes in us as a hospital and the services that we deliver. And so, I definitely would also say that if there are any issues, I am absolutely welcome to have folks come and approach me or us as an organization to see how we can further improve.
That's great. I don't know if you can't track everything, but I know I've certainly seen a lot of very positive comments over the past year, 2 years, from people just in on social media platforms saying a lot of thanks to the hospital, saying a lot of those things. And you go back 10, 15 years ago, 15 years ago, social media wasn't as prevalent. But you go back not too long ago, and that wasn't happening, or there were no comments. And I'm seeing comments now, a lot of thank yous, and so you're making a big difference in that. So that's very positive. It's a good term. I want to make sure that we mention your website, which is ckha.on.ca. And then, as I said, you're on different social medias out there with the hospital. You have had some fantastic patient stories on YouTube and those type of pieces. And then a couple other quick reminders because I pull up some health quick reminders. I did my research. National Hand Washing Awareness Week is this week.
Oh, terrific.
So there you go. Get your flu shot.
And get your flu shot.
Get your flu shot.
I was going to say, that reminds me to say that.
There we go. It was like
absolutely.
Time. There we go. Get your flu shot. Go out there. Get it. Thank you. I really appreciate you being here. Hopefully we get to do this again next year, and you can give me another update.
Absolutely.
And it'll be 99.9% or...
Let's hope so, yes. Exactly.
Still 97.9. That's... Even let's just round it. 98% is phenomenal.
Yeah.
That's if we could all achieve 98% on everything in our lives, I think the world would be a much happier place.
Oh, for sure.
So,
for sure. Good.
That is well done.
All right.
So
Thank
you very much.
Andrew.
Thank you, Chatham-Kent. We'll see you later.